You have back pain and you're really suffering, and the diagnosis is spinal stenosis. I'll explain to you what that is in a minute, but for now, spinal stenosis may be a diagnosis that says something has shifted, but that may still be unrelated to your back pain, and so I'm going to show you 3 exercises that in most cases will help you get a good handle on that pain and get rid of it for good. I'll show you briefly what the spinal canal is anyways. It's this area here that runs along your spine from top to bottom. It's the main supply system, the nerve cord from which all the other nerves are branching off into your whole body. Now, whenever excessive forces are in action, the individual vertebral bodies shift, and you may suffer from a slipped disc, a prolapse. That may lead to a narrowing of that canal, sometimes only mildly, but sometimes dramatically. In our experience, however, this narrowing of the spinal canal and your back pain are 2 separate things and not connected, and that means I'm going to show you with these 3 exercises how to liberate your muscles and fascia in a way that banishes your pain. And in case your spinal canal is truly narrowed, it could and probably will regain space because the tensions that narrowed it down in the first place are released more and more thanks to these exercises. Ina is with us again, and we're going to show you an exercise you could do at home, and I'm going to do the explaining. Please, just stand at ease with your feet at shoulder's width for our first exercise, and we're going to deal with the axis of tension and excessive tension in the front and back. In the front, we find the main cause we have to remove first, and that means stand up, place your hands on your lower buttocks, not too high up, to prevent your back from arching too much. So put your hands at the lower side of your buttocks, and now you're going to move only your groin forward and bend your upper body back, even your head if you want to. And now, everything is getting stretched apart that has been shortened and contracted while you were sitting. And if you could take it, start with 20 seconds, then go for a minute and a half. It's just a question of practice. It's better to do this for just a few seconds, 10 or 20, than to do nothing at all. Slowly increase the duration, and after enjoying it for some time, come back up again. Part of the exercise is, of course, the counter movement, because in the back, everything is tensed up. Your back extensors are hard as wood, and that's why you should simply bend over forward, stay nice and relaxed while you do this. Maybe you can only get this far before it starts hurting. No problem. Then start the exercise here. Here you should feel a stretch. Either you feel a stretch or pain in the back, maybe even in your buttocks. It's all good. Stay under 10 on your personal pain scale. So do your exercise there. Bend over forward for 2 minutes. See, Ina here is leaning on her knees, and that shows you how your body, your tissue, is giving in, yielding. The more you slide down with your hands along your legs, the more your muscles are yielding. It's a good way to check on the progress of your stretch, and your goal is to come down all the way. And then everything here is nicely relaxed. And then you slowly get up and repeat exercise number 1. Why? Because this is one of the main problems, so you can't do this exercise often enough. And just as you did at the beginning, bend slowly backwards and stretch everything here in the front. With the next exercise, we're going to deal with the lateral tensions that are too excessive. And it's easy to understand that the spine is surrounded by muscles and fascia and ligaments, and we've already cleared everything up in the back and front, and now we're going to relax the lateral forces. Now, for this, we're going to work on the side. The idea is very simple. Let's begin. Bending towards the left. That means we're stretching the right side, lifting our right arm, bending it over like this, and pulling our lower arm to the left. But be careful to stay in this vertical plane. Don't rotate your pelvis or your shoulders. Keep a straight line. Imagine a plane made of glass is going through your middle, and you shouldn't stick out on either side, but stay straight on that plane. And then you'll notice a stretch here and there. The more you pull your arm to the side, the stronger the stretch becomes up here. Do that for 1 or 2 minutes. The best thing would be 2.5. Slowly approach that time frame. If this is the first time for you, it's not going to be easy right off holding it like this. It takes some practice, every day a bit longer, 10 seconds or so. Then we leave this position and do the same on the other side. Since you don't want to walk through life lopsided, always work on the other side as well to compensate. Here, the same principle applies. Stay in this plane, pull over here with your arm, and try not to move your pelvis or shoulder out of this plane. And here too, at the beginning at least, stay for 30 seconds, and then slowly work yourself up to 2.5 minutes, and you'll notice here how your hand is sliding down your leg millimeter by millimeter. And that's good feedback on how your body is reacting. That's the way it should be, because you feel like you're winning, thinking, things are really moving down there. And always remember, the spinal canal that has been narrowed by all these forces is being relieved from those forces acting upon it. And so everything that has been shifted to narrow the canal is being pulled back, and things can return to normal. And then you get up again and stand up straight. And the third exercise completes everything. Now, what do I mean by that? Now, we start with rotating, and that's just great for your spine. Why? When you rotate, the gap where your disc sits will be pushed together across its entire surface, so all the waste can be squeezed out of the cartilage. And when you rotate back, you take the load off, and everything expands again, and at that moment, the disc can soak in all the nutrients it's surrounded with. That's the nourishment for your cartilage. So if you want to feed your cartilage, just rotate for 10 minutes from left to right and vice versa. So how to do this? Well, let's stand at shoulders width, our feet shoulders width apart. Take both arms up, horizontal position, and start rotating. And if you rotate to the left, rotate, and then have your right arm follow through and pull your right forearm leftwards as well. Now your feet shouldn't move, otherwise you'll cancel out the stretch. And that's why the feet have to be anchored. Lean into this and try to rotate inwards a bit more, and then a bit more again. This kind of stretch is called an active stretch, and the advantage of it is that you don't just simply stretch, but it's also a strengthening exercise. And it's important that your spine is surrounded by strong, but also flexible muscles. A lot of people have strong muscles, but they're not very flexible. And that leads to spinal stenosis, a narrowed spinal canal. And that's why you should relax everything and become more flexible. Do the same in the other direction. And now the feast for your discs continues. Again, the waste is being transported out. Great. Your body is simply built this way. That's your body in action. As soon as it moves, it is being nourished, your metabolism kicks in, and the less active you are physically, the more everything shortens, contracts, and becomes inflexible, and your metabolism slows down too. The two main reasons for health problems and pain. Pull into the rotation. Increase the effort until you've reached 2.5 minutes, and then slowly rotate back. Lower your arms, shake loose. These are 3 exercises to liberate your spine. Clicking here takes you to even more valuable exercises for your back pain. That's all for today. Have fun with the exercises to gradually reduce your pain.